Hi, my name is Dr. Vasu Bhavaraju, and I'm a pediatrician and the Chief Medical Education Officer at Phoenix Children's Hospital. I just recently published Leveraging the Electronic Health Record to Measure Resident Clinical Experiences and Identify Training Gaps, a development and usability study in the Journal of Medical Internet Research, Medical Education. In our paper, Leveraging the EHR to Measure Resident Clinical Experiences and Identify Training Gaps, we really tried to find a little bit more detail on how to define experiential learning. Obviously, residents need to see patients in order to learn from them. But what was the optimal number and variety necessary to do so? And how can you get that information in a way that's easy to extract? We decided to use our electronic health record to try to answer that question. And we found that the timing was fortuitous because we all know that with the COVID pandemic from 2020 for the next few years, the types of patients that our residents, particularly our residents in pediatric hospitals, were seeing really changed. And so we wanted to see if we could use data from the electronic health record to see what was the impact of that shift in volume and variety of patient experiences in order to answer the question of how can we address those gaps so that we know that our residents are going to be competent in those areas once they leave training. So why JMIR? Well, we chose to submit our research to JMIR, specifically the medical education publication, because it seemed like the right fit. We had explored some medical education journals, but it didn't seem quite to catch the same energy that we had hoped for. And as we started to look at the articles that were published in JMIR, its reputation and ranking, we realized that this was really the perfect location to marry the medical education angle along with the use of technology in innovative and creative ways to really optimize the work that we do.